Welcome to the podcast, It's Not You, It's PCOS. Hi, I'm Laura.
And I'm Nick.
We are two expert accredited practicing dietitians and nutritionists specializing in nutrition for PCOS and fertility.
Together we have over 25 years of experience, and we want to reassure you that if you have ever tried to make diet and lifestyle changes and failed, it's not you, it's PCOS.
Stay tuned as we share our favorite evidence-based nutrition and lifestyle tips that we use with our own clients every day,
so that you can start to feel your best with PCOS.
Welcome back to It's Not You, It's PMOS, where we break down the science behind PMOS in a way that actually makes sense.
Hi, I'm Laura Attia. I'm a fertility dietitian specializing in PMOS, fertility and women's health.
And I'm Nick, and I'm all those things too. And today we're talking about vitamin D, one of the most common nutrient deficiencies seen in women with PMOS, and one that people often underestimate.
Yes, this is a really important conversation because we are having these conversations in our offices, but I don't think it's really reaching the broader community. So I think it'd be great to talk about what vitamin D does and what's the link, what's the connection between it and PMOS. So I thought this would be great too because there are lots of people on vitamin D supplementation, but usually it's done incorrectly. So let's make sure that you understand the role of vitamin D and how it works in the body and why we should sort of get some help on this.
Yeah, it definitely comes as a bit of a surprise when I've got this uber focus on my patients' vitamin D levels because I think when people hear vitamin D, they immediately think bones, not other things like PMOS.
Yeah, exactly. But vitamin D actually does so much more in the body. It actually works like a hormone, and it's a fat-soluble vitamin that actually helps absorb calcium, which is that really important component that's needed for bone strength and skeletal health. So that's the part we do know, but the part that isn't as well known is that vitamin D is involved in many other processes like immune function, inflammation and regulation, mood and mental health, glucose metabolism, muscle function, hormonal signaling, and reproductive health. And what's interesting is that the body has these vitamin D receptors in multiple reproductive tissues,
Including the ovaries.
Yes, so vitamin D receptors are found in the ovaries, the endometrium, the placenta, and the pituitary gland, which kind of tells us that vitamin D likely plays an important role in reproductive health and hormonal health.
Yeah, if you've got receptors there for vitamin D, then vitamin D's going to be contributing in some way or form. So it's not just about preventing deficiency of bone health anymore.
Not at all. Emerging research suggests that vitamin D may influence sex hormones, ovulation, insulin sensitivity, and even those inflammatory pathways. And it's because PMOS affects many of these symptoms, and researchers have become increasingly interested in that relationship between vitamin D and PMOS.
So why are women with PMOS more at risk of vitamin D deficiency, Laura?
There's a few proposed reasons. Firstly, vitamin D deficiency is very common overall, especially in women that are spending more time indoors, wearing more covered clothing, or living in areas where there is lower sun exposure, particularly, during certain seasons as well. But in PMOS specifically, we also know that insulin resistance and having higher body fat levels are common and may affect how vitamin D is utilized. So vitamin D being that fat-soluble vitamin, it can become stored in fat tissues and become less available for the body to use effectively.
Mm. So even if someone technically has vitamin D stored, the body may not access it as efficiently?
Exactly.
Yeah.
There's also some evidence suggesting chronic inflammation and metabolic dysfunction seen in PMOS may affect vitamin D metabolism and that activity within the body. We do know, obviously, that there's those lifestyle factors that can contribute also. So we're aware of that, and we know that women with PMOS do experience fatigue, low mood, body image struggles, and even depression, and may also naturally spend less time outdoors or engaging in movement, which can further reduce sunlight exposure.
Yeah. And what researchers are actually seeing when vitamin D levels are low in PMOS? What are they seeing?
So the sort of side effects of having low vitamin D are associated with higher androgen levels, increased insulin resistance, menstrual irregularities, ovulatory dysfunction, fertility challenges, increased cardiovascular disease risk factors. So again, these are associations, but we can say that low vitamin D levels directly we can't say that low vitamin D levels causes PMOS symptoms, but we can see that a deficiency may exacerbate those symptoms or contribute to poorer metabolic health.
So it may make an already dysregulated system harder for the body to manage, yeah?
Yeah.
Yeah.
One of the strongest areas we see this relationship is insulin resistance. Vitamin D appears to play a role in the insulin signaling pathways and glucose metabolism. So, low levels may worsen insulin resistance in some women with PMOS.
Which is pretty significant because insulin resistance is such a key driver behind many PMOS symptoms. I can't believe vitamin D is also implicated in insulin resistance. That's a bit of a game changer for a lot of our patients.
Yeah, absolutely. Because we know that when you have insulin resistance, some of those symptoms are that you've got, you know, difficulty with maintaining your body weight or increased cravings, irregular cycles. Acne can be a part of that picture, and elevated androgens can also be in that cycle, as well as ovulatory dysfunction. So, yeah, it does play a quite a big role.
Yeah. Well, what about mood? I've often wondered whether vitamin D is implicated in what is it, that seasonal, I can't remember the name of it. You might be able to help me out, Laura, but people that live in like the northern hemisphere that hardly see the sunlight, and there are associated mental health issues with that, and pretty sure that's got to do with vitamin D. So vitamin D is definitely implicated in mood because so many women with PMOS actually struggle with mental health as well. So I think once again, like, the name change to PMOS has been awesome because it's more multifaceted now. It's covering more of the body, including mood.
Yeah, and we do have that research that does highlight low levels have been linked to increased depressive symptoms, fatigue, and poorer mental well-being overall. So we know this, and we know that women with PMOS already have higher rates of anxiety and depression compared to women without it. So ensuring your vitamin D levels is another important piece of supporting your overall health, not just your reproductive health, and also your condition.
Seasonal affective disorder, it's called. I
Oh, you
just
found
looked
it.
it
Seasonal
I just
affective
looked it up.
disorder.
Yeah.
Love. Yeah. Yeah.
So then there's fertility, right?
Yep. So fertility, right. So vitamin D receptors in the ovaries and the endometrium suggest it may influence follicular development, ovulation, and endometrial receptivity. So a lot of people don't know this, and that there's that link with reproductive health, and you can see it's involved in those really essential processes where it may play that role in fertility. So some studies suggest adequate vitamin D levels may support that menstrual regularity and fertility outcomes, but we don't necessarily know where the balance is. That research is still emerging, and research on supplementation isn't consistent or defined as well as we would like it. But the research still says, we do want it to be at least adequate because that relationship is apparent.
So essentially what you're saying is some studies show improvement and others don't.
Yeah.
Yeah.
Exactly. So some studies suggest that vitamin D supplementation may improve that total testosterone, insulin results, and that's that measure of insulin resistance, total cholesterol, LDL cholesterol. So that's where those improvements were shown, but other studies showed no improvements in metabolic or hormonal pathways or profiles with PMOS. Yeah, so vitamin D is important, but it's not a cure. It's not the be all and end all, but it's important to recognize that it does play a role, and supplementation is a tool 100% if we have low levels or suboptimal levels.
Hey, Laura, one of the reproductive hospitals or one of the pregnancy hospitals over here in Perth have actually mandated 1,000 international units for all their pregnancy
Wow.
patients.
Really?
Yeah.
That is juicy.
Isn't it? So
I love that.
just thought I'd throw that in there.
I did not know, but I love that. That's amazing news.
All right. So let's talk practical strategies then. How do we get vitamin D in?
All right. So the sun is our main and best source of vitamin D. However, food sources are also helpful, and it's important to kind of have a combination of both, not to totally disregard our food sources, even though that does provide lower amounts. Food sources that are great for vitamin D are your salmon, sardines, trout, mackerel, egg yolks, fortified milk and fortified plant milks, as well as your fortified cereals and UV exposed mushrooms, which is my favorite. I like to do that. It feels like a nice little exercise to just put your mushrooms out on the windowsill to get some sunlight before
Awesome.
cooking them.
Yeah, that's so good. And what about supplementation?
Supplementation can absolutely be helpful. Again, tool in the toolbox, and particularly important if you do have a deficiency or insufficiency is identified. I think that's really important to get the pathology so that we can pair it up and make sure that we are also dosing it to be adequate for the result to increase it.
Absolutely. That's just making an informed choice rather than just relying on TikTok posts to look after your health.
Yeah. Yeah, exactly. You want to make sure that it's doing what you want it to do, right? And otherwise, you're just wasting your money. And we do know that it can be also harmful to do that. So vitamin D should ideally be assessed through blood work, and we don't want to get to that 25 high hydroxy vitamin D level. That is a deficiency. So if you're getting that result, then we do need to get some help there with some supplementation. So some women might not have those adequate levels, and we will utilize that as a tool. But if you're just taking a high dosage vitamin D, then you should know that vitamin D is a fat-soluble vitamin, meaning excess supplementation can accumulate in the body and potentially be harmful if taken inappropriately or for a very long time. That can also be problematic.
Yeah. So supplementation should be evidence-based, individualized, monitored appropriately. So, Laura, what are the take-home messages?
That vitamin D is important for a number of benefits in the body, number of roles that it plays. And that's, to reiterate, it's not just bone health, it's immune health, your mood, hormonal function, inflammation, insulin sensitivity, and reproductive health. Deficiency is common in women with PMOS and may contribute to worsening some of their metabolic and hormonal symptoms. So ensuring vitamin D sufficiency is important, but supplementation should ideally be guided by your pathology results and individual needs.
Yeah. And as always, PMOS management works best when we look at the whole picture.
Exactly. Holistic approach. We want nutrition, we want movement, we want sleep and stress and blood work, all to guide our personalized care, which is going to make the world of difference when it is really targeting what's happening for you.
Awesome. So I think we've covered vitamin D pretty well there. Hopefully our listeners got something out of it. But that's all we've got for today, folks. So thanks for listening to the podcast. It's not you, it's PMOS.
And remember, understanding your body helps when you work with it, not against it. We'll see you next time.
Bye for now.